Health Assessment PA1 Return Demonstration.
Good day, ma'am. I am Gentle B. Cañadora, a student nurse from ACT, and I will take care of you from this day. For safety purposes, may I hold your hands so that I can check your ID bar? Alright. By the way, I am here to do an assessment in regards to your skin, hair, nail, etc. But before that, I'm going to check your health history.
Next, you need to check the health history of the client and do an interview for additional information. After that, you should perform hand hygiene. Then, wear PPE that you needed. Next, you should provide client privacy. Inspect the general appearance and behavior of the client.
Okay, ma'am, I'm going to check your skin first. Can I have your hand?
Inspect the client's skin color, uniformity of skin color, check for the moles, scars, bruises, etc. Next, observe and palpate skin moisture. Next, palpate for edema and assess for edema if present. Note its location, color, temperature, degree of indentation. After that, palpate skin temperature comparing to bilateral parts. Next, you should note for client skin tugger. Inspect for client's head size, shape and symmetry. Next, wear gloves in checking the client's hair and scalp. Next, inspect the client's hair and scalp. Next, note for the client's face appearance, symmetry, expression, and movement.
Alright, ma'am. Can I have your permission to press your maxillary sinus?
Palpate maxillary sinuses for tenderness.
Alright, ma'am. Next, can you please close your eyes tightly? Next, ma'am, can you please smile for me? Alright, ma'am. Next, can you please frown for me? Okay. Alright, ma'am. Next, can you please pop up your cheeks? Okay. Next, ma'am, I'm going to inspect your eyebrow, your eyelashes, your eyelids, your iris, sclera, and pupil.
Check for the abnormalities of eyes, eyebrows, eyelids and eyelashes. Note for the position, color and movement.
Okay, ma'am, I'm going to inspect your conjunctiva. Can you please
Note color
move
and
your eyes
consistency
upward?
of lower palpebral conjunctiva and lacrimal glands.
Okay. Next, ma'am, I'm going to inspect your eye movement. All you have to do is you need to focus at the pen light and follow in which pen light where it goes. Okay? Alright, ma'am. Next, I'm going to inspect your eyes. What could be the possible reactions if this pen light it reaches or closes to your gums. All you have to do is you need to look at the distance, just look, and you need to focus on the pen light, okay? Just look at the distance. Okay. Alright, ma'am, you need to cover your right eye. And then read the letter.
D E F P-O-T-E-Z.
Okay, ma'am. At this moment, I'm going to inspect your ear.
Note the ear's placement, size, shape, color, presence of lesion or masses. Next, palpate for tenderness, consistency of the cartilage and swelling. Next, inspect external canal and tympanic membrane using otoscope.
Banana, apple, orange, watermelon.
Alright now.
Next, perform Weber and rinse test. Use a tuning fork to perform Weber's test and rinse test if the patient reports diminished hearing in either ear.
Okay, ma'am. Now I'm going to inspect your nasal or nose. Okay.
In checking the nose, note the nasal color, shape, consistency, patency, tenderness. Next, perform airway test. Next, inspect the client's external and internal nares. Use otoscope in checking the client's internal nares. Next, inspect the client's nasal septum.
Okay, ma'am. Next, I'm going to inspect your mouth.
Inspect the client's lips. Next, inspect the client's gums. After that, inspect the client's teeth. After that, inspect the client's tongue. Next, inspect the client's frenulum. After that, inspect the client's buccal mucosa. Next, inspect the client's palate and uvula. Next,
Can you
check
please
the
say
client's
banana?
voice
Banana.
quality.
How about blueberry?
Blueberry.
Okay, ma'am. At this moment, I'm going to check the last assessment, which is your neck.
Note for client's neck swelling, lumps and masses if present. Check the client's range motion of the neck. And lastly, determine strength of the SM and the trapezius muscle.